Test your Fmge. Previous year questions knowledge. Part 3. Question 1. Post-term delivery is termed as delivery after how many weeks? A point for 2 weeks. B. 40 weeks. C. 37 weeks. D. Point 3 for weeks. Question 2. What is the rate of cervical dilatation in the progression of the active phase of labour? A. 1 cm HR. B. 2 cm HR. C. 3 cm HR. D. 0.5 cm ER. Question 3. Ovarian drilling is done for which condition? A. Endometriosis. B. Polycystic ovarian syndrome. C. Ovarian hyperstimulation syndrome. D. Pelvic inflammatory disease. Question 4. A female is presenting with dirty malodorous discharge. On smear examination, trapezoid of A. Motile organism is noted. What is the diagnosis? Question 5. What is the sequential change in lochia? A. Lochia rubra, lochia serosa, lochia alba. B. Lochia serosa, lochia alba, lochia rubra. C. Lochia alba, lochia rubra, lochia serosa. D. Lochia rubra, lochia alba, lochia serosa. Question 6. Breastfeeding is contraindicated in which of the following conditions? A. Hepatitis B. B. COVID-19. C. Galactosemia. D. HIV positive. Question 7. Where does the uterus lies immediately after delivery? A. Above umbilicus. B. Below umbilicus. C. At pubic symphysis. D. Above pubic symphysis. Question 8. What is the contraindication for ventouse application? A. Fetal distress. B. Maternal exhaustion. C. Prematurity of fetus. D. Spontaneous delivery. Question 9. What is the preferred treatment for varicose veins nowadays? A. Stripping and ligation. B. Radioablation. C. SEPS. D. Phlebotomy. Question 10. A 36-year-old female patient recently undergone laparotomy. What is the sure sign of wound? Dehiscence. A. Copious serous discharge. B. Severe abdominal pain. C. Hypotension. D. Rebound tenderness. Question 11. Mutation in BRCA1 and BRCA2 genes should be checked in all of the following conditions except A. Breast cancer in males. B. Breast cancer with ovarian cancer. C. Bilateral breast cancer. D. Women with breast cancer diagnosed after 50 years. Question 12. Which is not included in quick sequential assessment score Q SOFA? A. Respiratory rate greater than 22 per minute. B. Systolic BP less than 100 mm Hg. C. Mental status GCS 15. D. Serum lactate. Question 13. A 60-year-old patient presenting with bladder cancer with involving of the muscle layer. What is the best management for this patient? A. Intravesical BCG. B. Intravesical mitomycin. C. Cystoprostatectomy. D. Radiotherapy. Question 14. An alcoholic patient presented with epigastric pain radiating towards back with anorexia, nausea, and vomiting. Serum amylase is -1,400. Other parameters are normal. What is the most likely diagnosis? A. Acute pancreatitis. B. Acute cholecystitis. C. Acute appendicitis. D. Chronic hepatitis. Question 15. While doing endoscopy, a constriction is noted. At the level of 25 centimeters from incisors, the constriction is because of our arch of aorta, B. left upper bronchus, C. right upper bronchus, D. right lower bronchus. Question 16. An adult male is presented with duodenal ulcer. Maximum chance of recurrence is seen after A. Truncal vagotomy, B. Selective vagotomy, C. Highly selective vagotomy, D. Gastrojejunectomy. Question 17. A chronic tobacco chewer for 30 years. Presented with swelling of left cheek on examination. A white membrane was seen over gingivobuccal. Fold what will be your next line of management. Point 1. Surgical excision, MBBS. To stop tobacco, and don't worry about the patch. 3. Chemical cauterization with trichloroacetic acetic acid for MVAC chemotherapy. 18. A homosexual man presented with painful defecation and felt protrusion with foul smelling, and is not reducible manually on examination. Call a flower-like mass and on biopsy squamous cell. Carcinoma of the anal verge is detected. What will be the next line of management? Point 1. Diverted colostomy. 2. Chemoradiation. Point 3. Excision. For abdomen, anoperinal resection. 19. Which of the following is not true about nephroblastoma? A. Spread by lymphatics. B. Early lung metastasis. C. Treatment is by chemotherapy and surgery. D. It is the most common intra-abdominal malignancy. 20. Which of the following does not lead to bilateral hydronephrosis? A. Phimosis. B. Urethral stricture. C. Posterior urethral valve. D. Retrocaval ureter. 21. Most important risk factor for acute mastitis. A. Massage. B. Breast engorgement. C. Lactation failure. D. Crack nipple. 22. During the formation of the embryo, if the blastocyst splits at day 0 F913, it will result in which type of twins? A. Dichorionic diamniotic. B. Monochorionic diamniotic. C. Monochorionic monoamniotic. D. Conjoint twins. 23. A 30-year-old female is presenting with dysmenorrhea and dyspareunia, uterus is mobile, and a nodule palpable on pervaginal examination. What will be the probable diagnosis? A. Fibroid uterus. B. Endometriosis. C. Adenomyosis. D. PID. 24. Female presents with blood pressure of 146/90 Fmge at 34 weeks of gestation. What will be the next step? A. CBC. B. LFT. C. USG. D. Urine dipstick. 25. Best parameter for assessment of gestational age is A. Crown rump length. B. Abdominal circumference. C. Biparietal diameter. D. Female length.